Our meeting's gonna start at 11:40. I'm gonna call the meeting to order. Can we have roll call, please?
Gerardo? Here.
Ana Guerrero here.
Tracy Vázquez here. Berenice Vargas here.
Alexa Huerta here.
Arabasti Canales here.
Margarita Garza present.
Enrique Madrid.
Francisco Adame.
Catalina Agüero.
Linda Llanos.
Freddy Cordova.
Jessica Hernandez.
Guillermo Wall.
Erica Lopez.
Romaine present.
Andy Flores.
Genesis Reyes. Nancy Cadena. Mara
Christina
Mendez.
Salinas.
Mara Mendez. Holly Ruiz present. Veronica Jimenez.
Maria Guerrero.
Dr. Chamberlain back here. And we also have
Nika. Okay, good. We did meet quorum. Great. Okay, do we have any public comment? No? Okay. Earl, do we have approval of minutes for last month?
yes, we did.
Okay, can we have approval of minutes, somebody that can, first and second, please?
Absolutely.
I'll second.
All in favor?
One correction, sorry, my name's on twice for present.
Okay. Can you take that one out?
Nancy Douglas.
One correction. All in favor? Yes. Okay. I'm sorry, I'm really not, Carlito that does this, but now, I'm taking over because we're waiting for her to get her,
Get appointed.
get appointed, yes, by one of the members that are vacant. So we're waiting on that. As soon as we do that, Colleen will take over again, but please bear with me. Okay, do we have an administrator report, Dr. Chamberlain?
Yes, good. So good morning. Yeah, good morning. We have 15 minutes. So I just wanted to share a little bit about some news that we do have. I think I might have mentioned in part of the opioid response plan that I've shared with the committee is that we have made a purchase or an investment into ensuring harm reduction throughout the community, specifically with Narcan access. So we acquired through our ARPA funds, Narcan cabinets and dispensing machines that will be placed. Specifically right now, we're looking within the zip codes that have the higher incidences within census tracts, as well for higher opioid or overdose response calls, specifically of course on the opioid side, and then also the mortalities that we have cataloged. So we will have that launch, that press conference news release on the 29th of this month, which will be at the Haynes Recreation Center. As soon as I do have the invitation set up, I will make sure that every member of this committee does receive that invitation to be present at that event. We will also be tying in the location via a map on our City of Laredo main page and on the City of Laredo Health Department page, so that way you can Google locate Narcan in Laredo and it'll take you to these spots. We will be refilling those on behalf of the City of Laredo Health Department and the City of Laredo Fire Department, so our staff will be rotating through there on a weekly basis just to make sure that there is continuing access to Narcan across the community. I also wanted to share that Chief Maciel recently retired, who was part of this committee, so we wish him well in his retirement. And in his place, I just spoke to Chief Rodriguez right now. It'll be Chief Gonzalez. Chief Richie Gonzalez will be taking his place here on this committee. He did let me know, as we have discussed in the past, about conducting a vaping sting operation to ensure that these organizations are selling to persons that are 21 years of age or older. So he said that they're coordinating with different enforcement agencies, and that'll happen over the course of December. We can't know dates because then that'll get out there and then they'll know about this. So that'll be happening over the month of November. So we're very excited about the initiative, the public health initiative on the opioid response plan, and then of course the enforcement side of the vaping situation that we're experiencing here in Laredo. So that's all the report. Those are the reports that I have available from us here at Laredo Public Health via the system. If you have any questions for me, please don't hesitate to let me know.
On number 5, thank you, Dr. Chamberlain. On number 5, discussion and public, possible action, the holiday public service announcement collaboration, that's something that you wanted to do?
So, the holiday season's coming and it's soon approaching, and we know that a lot of incidents may occur, depression possibly, people are around alcohol, potentially drugs. And so I was mentioning to Marina that maybe it'd be a good idea to work with public access to see if we can get a PSA for the holidays to wish everybody a happy holidays, but to also remind them that there are resources available within our community. And so partnering up with the agencies that are here to kind of just do snippets of these are the services that are available to you. So I don't know if that's something that could be done. I know that years ago we did something similar to it, so I don't know if we need to reach out to public access, or if through the county we have the availability to do some form of 30-second recording, or if anybody through your agencies have the capability to do a recording, then we would love to be able to do it on behalf of the Drug and Alcohol Commission.
Yeah. Anybody else that would like to help or do it through their agency, maybe PSA?
So the family is available, if you guys just want to write, you just send the narrative and then you send your ideas. We have all the equipment.
Jan and Taylor. Anybody else?
With Laredo Health, will be also
You can do it.
I can go ahead and get in contact with the PIO.
Okay. On number 6, detox facility update, Dr. Viviana Martinez. Good morning here.
Good morning, just not here, but here we are, Berenice and I. Our licensure packet has already been sent out to the state for our approval. We're waiting for them for visit us and what they're working through and that process. Our Congressman Henry Correa has been requesting for a ribbon cutting on December 15th. So we're planning on that. Once that everything is going to be planned and set out, the invitation will be sent. We had a job fair 3 weeks ago. We're also releasing some LVNs for the night shift and the evening shift. So if you know an LVN that would be willing to work with us, just send us to us and give them our information, and we will process them with HR.
The ribbon cutting will be for the detox facility?
Yes.
The grand opening?
Yes.
When would that be?
December 15th, but once we have the time, we'll send you an invite.
Okay, I don't think the judge is aware, and I don't think he's gonna.
This was just a call from the office of Henry Cuellar yesterday. It was,
Oh, I'll talk to Melissa.
yes.
Okay, I do have something, our last meeting, we had a couple of, ideas that were brought up or issues, and, we just wanna tell you all that we have never gotten an invite to go see the facility, and we wanted to ask if we can set up a date so the DAC members can go and see it.
Yes, definitely. Of course, we have major construction, and this didn't start until maybe last week or last week. Yeah, so we couldn't even have anyone coming into the facility because we still had major construction. But now we can set
Now
up a
we
date
can.
and we can, yeah.
Okay, Jesse, do you have a date in mind?
No, I don't have any date. I'll report with the detox committee. I just want to clarify the different phases. I think there's some confusion. But no, I mean, whatever y'all decide, whatever day. I mean, it's really up to the Roots Detox whenever they're available.
The major have visited the facility already before the facility, but yeah,
Do you have like any open dates available that maybe we can set up? You tell us this day and we'll go or be there or try.
I mean, y'all don't have clients, so it's basically.
Yeah, so it's again Monday to Friday.
Maybe a
9
Sunday?
to 5.
Just kidding.
So maybe like a Monday to Friday,
9 to 5.
can we go like whenever we have time, or do we have to set up like a?
we would like to set up an appointment, so obviously you can visit us.
Okay,
If you want
Wednesday of Thanksgiving, before
Or
Thanksgiving.
the 21st, if you would like.
The 21st is Tuesday.
On that week.
Could we do the 20th, the Monday? Monday's a lot easier, Monday,
So Monday maybe?
Yes, I would.
Yes.
At 10?
No, I don't know.
10
10 a.m. is Monday okay for you, Lucy?
Monday to what?
Earl, Monday the
The
20th?
20th at 10.
Well, I'm okay, I've got a dentist appointment that day at that time, so I'm, you all go, I mean, I trust it looks beautiful, you can take pictures and show
Okay,
them.
Nancy, can you make it? Mara?
I can make it.
Yeah. Yes, so then Monday the 20th at 10? So we're gonna set up for that Monday the 20th. Anybody else can join, we don't have to be all deck members, we can, our people here can go too. Yes. Okay, so you all are invited then, Monday.
I'm right next door, so I'll just walk over.
Okay, very good. Okay, let's see, on, stakeholder agency updates and presentations, we have, Ms. Veronica Jimenez from, SCAN, and she came to give us an update on, Red Ribbon.
Yes, good morning, everyone. We've been having a lot of presentations at the schools, since it was Red Ribbon Month. We did have the kickoff to Red Ribbon Month at Warren High School. It was on the 11th of October, and it was really nice. There was a little parade around the school. There were the cheerleaders, the football players, the band. Everybody was involved, and we went around the school, and then we've gone into the gym, the baby gym, and we had different guest speakers. We had the ASAC, the one in charge of the DEA here in Laredo, and we had the sheriff, we had LPD, we had Chilo, we had a whole bunch of people there. Everybody just trying to raise awareness on the dangers of drugs, trying to, talk to the kids, encourage them to be drug-free. We had a lot of students present. We had the media there. It was really, really nice. The mariachi there, they were playing. It was really, really nice. We took a lot of pictures. I did share them with the coalition. And after that, after the kickoff and everything, everybody got to go outside, and we took pictures and everything. Dr. Rios was there. It was really nice. So we had almost 50 presentations in total for the coalition that they did, but the prevention team at SCAN had a lot of more presentations, right? And we focused on vaping. It's a big problem in our community with kids, marijuana, prescription drugs. We talked about different drugs, about Química Marina. It was just an overview of why, we have Red Ribbon, right? And it was really nice. We also got to go to TAMU. We took our simulator, our DWI simulator, to show the students there that it's very dangerous for them to be drinking and driving. We also took it to several of the high schools during lunch, and we were there, and the kids, they have fun, but at the same time, they realize, that, when you put those goggles on, oh my goodness, like, you really feel drunk, you really feel that you cannot focus and you cannot drive. So it was really, really nice, and we do this every year for Red Ribbon, and we're pretty busy for November. Right now I have staff at the UISD schools doing presentations and doing a lot of different activities. We also have the arts and crafts, the mindfulness sessions, the yoga, the Zumba for the students and for the community centers as well. We have modified Zumba and yoga for the elderly at the community centers as well. So we're pretty busy over there at SCAN. Does anybody have any questions?
I just want to thank you because, I know my wife appreciates it, at the schools, there's Lada and all the counselors at LIZ, I know the UID counselor, Randy used to use it quite a bit. You mentioned Enrique Camarena, just a little history. In 1989, the Laredo State Center hosted Enrique Camarena's mother for the beginning of Red Ribbon Week. She came down to Laredo, she spoke, and it was a very nice event, and I appreciate all the work that you all do. Your team.
Thank you. And if anybody wants any presentations, we do presentations for the parents. And I do want to mention that we took part in the DEA Take Back Pill. It's a national event that they have every 6 months, and we had it on the 28th of October. It's always the last Saturday of April and the last Saturday of October. And it's always from 10 to 2. And we were there on the 28th, and just for 4 hours, we were able to collect over 1,500 pounds of medication. And it was over 90 big boxes of medication, so people are still helping us out, we're always there trying to raise awareness, trying to educate people, get rid of the medications. I don't know if it's maybe because of our culture that we want to hold on to stuff and we don't want to throw it, but like medication does expire, and some people, the elderly, think it doesn't. Sometimes in the pharmacy, they give you the little bottle and it doesn't say right that it expires, and they tend to think that it doesn't expire. So they hold on to it, or they want to give it to somebody else, right? You have the same symptoms, you can take it, right? So we're always trying to raise awareness. And we also do have the little medication disposal pouches that we give out during presentations to the parents, so they can dispose of the medications. And we have the different sizes. We have the small and the large. And we're always out there trying to raise awareness. And it was a big turnout. We also had a little bit more than 30 pounds collected from the Zapata, because we do have an office in Zapata as well. So we had a really big turnout, so we're very happy that, everybody's cooperating with us to try to raise awareness. That was about it. Thank you.
There is some disposal sites every year, right? Like,
Yes.
Year round?
Yes, we do have, so in case people were not able to take advantage of the Take Back Pill, the DEA had, we work with different law enforcement agencies. We do have one at, with Sheriff Guaya downtown in Victoria. We have with South, with Constable Villarreal, in the north with Constable de Valley. We have one at Tamiyu in the police department. We try to do that because we know that some people can't go, or they just forget, so they can't go during those times. And we can't be giving pouches to everyone in Laredo, right? So we have those sites where from 8 to 5, Monday through Friday, you can go and drop off your medications. Because it's asked, and then they get rid of it. They give it to the DEA and they get rid of it. So we do have those sites, and I can send you the information so you can share it with everyone.
You said Tamiyu and who else?
Tamiyu, Constable de Valley in the north, south, and Villarreal, and the Constable Villarreal in the south. So
The fire department was asking the last time, if they could possibly have or host a site.
yeah, we were there for the take back in the fire department.
But I think they were asking about. like,
Yeah,
year
they
round.
always ask me, but it has to be like law enforcement.
So at Tamiyu, my question is, where is it at
At law
Tamiyu?
enforcement.
At the
The
PD?
PD. It has to be a law enforcement.
Got it.
They've asked me before. Yeah, the police department has one.
Okay, thank you very much, Ms. Jimenez. We're gonna.
Oh, can I just,
Yes.
I'm sorry, we do have an issue with syringes. I don't know if the health department can help us with this. There was a lot of people that took syringes, and sometimes we have to tell them that we can't. This time we did get them, but the DA doesn't take any syringes, and there's a lot of people that have diabetes and have, so there's a lot of accumulation of the syringes, and people don't know what to do. That's always been an issue, and when we have meetings with the state, because they fund us, right, I always bring it up, but they've never given me a solution for it. But I don't know, maybe because of funding or whatever, but is there a site where people can take their syringes here in Laredo free of charge? Does anybody know?
Doctor?
Not that I'm aware of, there's not a central drop-off point for syringes. There is guidance that is provided via EPA online on how to properly dispose of them when they go into the landfill.
Okay.
But as of this moment, we don't have a syringe take-back program either here with us at Public Health.
Oh, all
But
right.
it's something to look into, definitely.
Thank you.
Yes, ma'am.
Thank you, Ms. Jimenez. Again, next we have Alexa Huerta with Pillar. She's the OPC for the Project Pod Director, right?
Yes, thank you. So I want to give updates on the harm reduction vending machine that we have. There's a harm reduction vending machine located in the Fire Station 3. And so far we had a total of 45 and counting individuals enrolled into the program with access with the vending machine. And as of right now, there's a total of 95 items that are being dispensed monthly. And the biggest one that has been dispensed the most has been the safe sex kits, because it is in San Bernardo. We do believe that is a very high risk area for sex workers and such, so that way we do realize that correlation is there. But we are very excited and very eager that people have been interested, and it has been it's been accepted by the community. So hearing Dr. Champion mention the Narcan cabinets is music to my ears, because of the need in our community. So just want to give you an update that if you all know anybody, we have the vending machine there for your access to these individuals 24/7. Thank you.
Anybody else?
Yes, continuation of SCAN. We are currently hosting a coat and blanket drive.
Okay.
We've already begun the process. We are taking it at both sites, at the Hendricks site and the Saldaña site. We do have other offices, but those are the big ones where we can keep all the donations.
What's the address again?
1605 Saldaña and 1702 Hendricks. I do have some pamphlets, and I'll pass them out in a bit, Chairman. So yeah, we do have our outreach workers going out. One of the things we've noticed as the weather is changing, specifically when you get those periods when it rains, when it gets really cold, there's not a lot of blankets out there. So we want to make sure that we help out those in need. So
you all know we have extra blankets or?
yes, if you have blankets or coats, feel free. If not, give me a call.
Meal, right? Or they can be, I think she can be meal and you gently used. Okay, as long as they're clean.
Yes.
Okay.
Yeah, you can call us, and you can pass by, pick them up, or help. Really help.
Any stakeholder announcements?
Oh, I have a question. I don't know if you can. This goes back to the detox. Do we have a criteria of people that will be eligible to enter detox? And what is the referral process and admission process?
We do have a criteria that is going to be on the website as well. So as long as they meet the crisis dependency criteria and which
There's already a website?
There's going to be a website. It's not ready yet, but it will be in the website as well for the referral.
Still, patients can come in and ask for information about our availability for beds, or they could call us and make sure that they are meeting the criteria, so we have a space for intakes.
Well, thank you. Appreciate it. One more thing. I don't want to monopolize. SCAN does have residential treatment facilities for adult males and specialized female program. We used to have a adolescent female program for substance abuse population. Unfortunately, we did close that again due to the lack of referrals. So if you have individuals that need some type of residential type of treatment, go ahead and contact us. And you can contact any office, you can contact me, and we'll put you in the right direction.
So you say it's closed?
The female youth residential, that one is closed. And again, the reason I'm bringing it up is that these programs are for the community. They're at no cost. However, we do need the support of the community to keep them open. And what I mean support is helping us with referrals, keeping them busy.
So by referral, you mean it's gotta be from a doctor, or can
No.
they just go in?
No,
or
it
you
could
call
be
and tell you-
anybody, it could be the person themselves, it could be a family member saying, hey, I need some help.
Because to be honest, I just got a message like 2-3 days ago. Somebody needed help. I did refer them to Grace Center with Pastor Iram Reyes. I don't know if they went. I need to call him, but I do get a lot of people that call me, so I can just send them over to you. Do they have to pay, or how's that one gonna work?
With SCAN, all the programs are free, especially the substance abuse. If they do have Medicaid, we do, especially for our youth, we do go with that, but for the most part, there is no fee to the client or to the individual.
But will you take them under the influence, or if they're going through withdrawal?
So
do they have to
there is a process that's that's why we like the detox, and there is a process. If a person is under the influence and can't communicate, we have to do various evaluations in order for that to make that happen, to find what type of placement. Do they need outpatient? Do they need detox? Do they need residential? So just because you send them to scan doesn't mean they're gonna go to scan. It could be a person that needs detox, it could be a person that needs residential, it could be a person that needs outpatient. It could be mental health. So when an individual comes to our doors, we're just not looking for a specific program. We're looking at what are the services within the community that can meet the needs of the individual. So it could be with one of our residential facilities. It could be Liberty Lodge out in the Corpus area. So we just looking for space to put the individuals. But if they are under the influence, highly under the influence, then it does become more challenging. But we do have processes in place to help out.
So I guess my follow-up question would be is what is your current wait list for both the women and the men's facility? I know the drug court particularly refers over to La Serenidad. Normally we will place our participants in custody because they are presently under the influence, and really that's the only place that they'd be able to get detox and have a medical evaluation. So
let me correct you real quick on, not correct, but our residential facilities are not detox facilities. So if the person is highly, or not highly, if he is under the influence, most likely he won't qualify for a residential facility until they get detox, and that's where.
And that's where I was leading my question to. I would like to know what the wait list is when we refer somebody to be able to obtain a bed. Our individuals, particularly in the drug court, will await at the jail until the bed becomes available. So they'll go through the withdrawals, they'll have the medical evaluation done, and they're monitored obviously on a daily basis because they're going through the withdrawal. My question is, how long does it take, more or less right now, to be able to get an individual into a bed?
I have to talk to the director.
Okay.
But the best way is calling each facility. At least for Humberto Peña would be for, and I can give you the numbers for an email.
I think I have Mr. Peñas. Is there a different director for the female unit?
Yes, Nancy Garcia.
I have a question. How do you measure the withdrawal? Like, how do you measure when they get to your facility? How do you know if they meet criteria?
Well, there's a variety of evaluations that we do, plus the interview itself.
Okay.
And then that's how we determine what are the needs.
Please read that right there.
On the evaluation. Okay.
Typically, there's a CWAP protocol that people use to determine if they need detox or they're under the influence. So the CWAP protocol will go ahead and determine that. I'm sure you use something similar. I know that you all have a direct version of what we do, so either one works. You mentioned Grace.
Grace Center, yes.
Yes. Wow. I had the pleasure of going to the center. I had lunch with Pastor Diaz, and I went to the center. You know that they have 28 people there, primarily heroin addicts. I got to see the people. I got to talk to them. It's a beautifully run place. Of course, you know, they need funds. You know, they take care of themselves. Pasan por la Malia, they take care of themselves there. And it's all spiritual, but, you know, I was talking to Pastor Diaz and said, oh yeah, our outreach people could get a lot more. That's how many people are out there. Just 28, that's his capacity. And he says, oh, we could do more. But I really want to congratulate you because I think it's just a wonderful, wonderful place. You know, I went to the previous Calvary Center, and it was always very nice. And this is a wonderful effort you guys are doing. The guys are really neat. They provide them with work skills and all spiritual, but they're looking for other help. They need some treatment. And I told Pastor Diaz, I said, you need to get together with some of the nonprofits and their place needs to be licensed. And so if anyone in a nonprofit that is licensed is willing to go ahead and license it for outpatient services, man, you've got an audience right there. You'll be able to draw down your money. So I'm just encouraging you all to have licenses to work with Pastor Tejas because they need it. And, you know, it's just.
If no one steps up, you can contact me and I can help you guys through the licensing procedure. So it would be your own license.
I don't think that they want to license it. They're working towards establishing, they're a nonprofit, they're working towards doing it. It's more like what Pillar does with the drug court, that they put a license, their license at the drug court.
Right.
So it's a satellite office. So in other words, whoever would work with them would have it as a satellite office and they provide services there. So it's not licensing. You know, that's the, you know, I told Pastor Tejas, let's take one step at a time, and right now let's see if you can get some services by having someone willing to step up and give them a satellite license like Pillar has done with the drug court.
So, you know, you feel free to call me.
Yes, I will mention it too. Pastor Tejas is my husband. I'm.
Oh, really?
Janice.
I had no idea.
Nice to meet all of you. Thank you to each and everyone here. Our dream is, you know, and our vision is also to work together and to help this community. And thank you to each and every one that is here. If there is anything that we can do to help, please also let me or my husband know, and we're here to help and work with everyone here in the community. Thank
Where
you.
is Grace Center located?
On 1118 East Commerce. It's right behind Christy Lynn's. If you put it on the GPS, it kind of sends you somewhere else. So it's right behind Christy Lynn's.
But the guys are so neat. It reminded me of that Cinderella movie with with Seven Dwarfs. They were all working and happy and dancing Christian music. It was pretty cool.
If there's events, somebody's having an event, he actually takes the guys. Like when I did the 5K run in the event, the guys were like super helpful. They were the ones that gave the water. They were the ones that were greeting people. Like they're like super. It's super good.
Did they attend our meeting a few months ago?
They did.
They did,
Yeah. Now going here, one of the things that's really more serious. We've talked about how when someone goes into some type of treatment or residential. The addict dying, and so Pastor Tejas was showing me one of the young men that left and overdosed. He was in the hospital, and he showed me how, obviously Narcan saved his life, how he was back, but you know, that's an area that, you know, as we're talking about continuing care that we need to work on. Congratulations! I was very impressed.
That was my center was actually my dad.
Yes, I know. I know that.
But thank you so
Yes.
much.
Real quick, because I know there's a lot of nonprofits, right? So, as you all know, I work with General Pharmacy and we specialize in behavioral health and substance use disorder medications. But we also we're working on a health equity initiative right now for flu. And so what that is so we're actually owned by United Healthcare and Optum. So United Healthcare has granted us quite a bit of funds to be able to offer free flu vaccines to those who are uninsured. Because I know even if you're uninsured, you go to HEB, try to get a flu shot, they're still going to charge you something. We do it absolutely free, and even if they're non-citizens. We're not going to check anything. So I've done quite a few in Brownsville, these flu clinics. We've done it for the county jail. We did it for the inmates. We did it for Brownsville ISD. So we did, like, for example, the employees had insurance. So obviously, we run the insurance. But for any families or students that did not have insurance, we do not charge them anything. We give them the flu shot right on the spot. So if you all are interested in any of your facilities or programs to have a flu clinic, our pharmacists can go out and do these flu shots, because we know that this flu season is supposed to be pretty bad. So we're trying to get as many people vaccinated as possible. So like I said, we do specialize in behavioral and substance use, but we're working on this initiative for flu. So I think it'll be beneficial if you all have a lot of uninsured clients or patients. Feel free to give me a call and we can set up a flu clinic for you guys.
How long do you usually stay out at the site?
It depends. We ask beforehand how many people more or less do you think we're gonna have, and then we kind of set up the time, to say, oh, we'll be there between 10 and 12.
Cost to the client?
If they're uninsured, if they have insurance, we will obviously run it through the insurance. If they're not insured, like I said, even if they're non-citizen, we don't charge them anything. It's absolutely free.
Do you have like a phone number or contact information?
Yeah, my number, my name is Cristina Salinas. I'm with Genoa Pharmacy, GENOA. And my number is 956-693-7850. That's myself.
Do you do home visits for individuals who are bedbound?
Ooh, that we cannot do. We usually try to do just like come to the facility, come to the centers, or, and do a food clinic there.
Mariana, earlier you mentioned that sometimes people reach out to you looking for like what kind of services, resources. You can also provide them the information of OSAR, and so we can do an evaluation. It does focus on substance use, but if they have mental health issues or they're needing any kind of health care, we can go ahead and connect them. I'm stationed in Laredo, but we do have 7 other counselors, and so if they're not able to come into the office or meeting, like just a phone meeting, any of our other counselors can also do that.
This particular individual, he had just overdosed, and he was actually in the hospital looking for a place to go because he was homeless and stuff. So his sister's daughter was the one that contacted me. And like I said, I did refer him to the pastor. I don't know if he went. I need to go and ask the pastor and find out, and if not, so I can refer him to somebody else. Maybe with for that person.
And thank you for mentioning those. When Kiko was having the discussion, I said, well, I'm sure you all, just like the other nonprofits who the Ozar, and that would be a good resource for you, linking up with the Ozar. So thank you.
Do we have anybody else? Anybody wants to say anything?
Oh, I will.
Yes.
Hi, I'm Guillermo Walls. I used to be on this committee as a representative from the health department. Now I'm with Webb County, and I'm the director of the Community Action Agency. So I've always worked a little bit with the detox program when it was coming through, and I'm just delighted to be back attending the meetings.
Nice to have you guys, Mr. Walls.
Yeah, thank you.
I do have one question. I know when SCAN starts their meeting, they always have an invocation, and I wanted to know if it's okay with everybody that I add an invocation to our meeting.
That's appropriate.
Yes. Can you do the invocation so we can end it, Pastor? Yes. Earl, thank you for the food.
Yeah, I thought we were going to have, before the invocation, I thought we were going to have at least a discussion of the different meetings that we had, right? I know prevention had meetings, rehab meetings. So we did have a meeting what was originally started off as a detox committee, what we call phase 1. And I want to clarify some things. I appreciate Dr. Martinez's letter where she mentions that no one will be turned away. That was a clarification that we wanted to make sure of. But we did meet, and Scan was there, Kiko was there, Margarita was there, I and Ileana were there from Pillar. A couple of representatives couldn't make it. But I just wanted to kind of talk about this confusion. Back in 2013, WestCare, which is the biggest nonprofit in the United States, was coming to Laredo to take over a program from Staccato. At that time, as Margarita mentioned, there was a lot of clients that we had no place to put. West Care, Judge Oscar Hale, had this idea of doing a detox triage center because we had no place to put all of these people. We had used so much Vivitrol in the first 3 years with all the opiate addicts. And we saved the community over $500,000 in those first 3 years. And so that first drug and alcohol committee, West Care, they actually bought into it. They got their architects. They were willing to pay for the remodeling of the juvenile center, which the county was going to give them, just like they did this time. The city bought into it, and we needed the 2 hospitals to buy into it. The problem was that as we had discussions, only 1 hospital bought in, and eventually it just all failed out. When we started this one, it was more a bottom-up approach, and we all understand that we're just an advisory committee. We understand that in the end, the city and the county are going to make decisions, and we're here to advise them in the best way possible. I have never been to the new facility, but I know that facility back from the day when I used to work with kids and was a juvenile. I obviously am the evaluator for drug court and the veterans court, so I'm there all the time. When we started working here on this particular idea, Errol and I, we went to go look at the facility with Dr. Gonzalez, and we're looking at space. I said, this pod can only fit 1 person, and I had the idea of, hey, let's look at this. And he had the plans, and he was saying we could do this and this and that. And that's how it started, right? And of course, we appreciate the county's effort to put that in. And so that's how it started off. Sometime in 2019, right before COVID, we had a very big meeting with all the CEOs because we were moving on this detox plan, and we, every single detox nonprofit here has people that they're going to refer to the detox. Okay. And we had this meeting talking about how we wanted it to eventually, as we got one further, we wanted it to go out for requests for qualifications so that someone who has the qualifications could provide the services. And so all the different CEOs were here and their administrators and stuff. Phase 1 obviously was the detox. But when we went to that visit, Gerardo, Dr. Gonzalez and I, we walked outside, remember Gerardo outside where the recreational part was for the juveniles? And we talked about, hey man, this would be a great place for a residential facility. And so that's where we started talking about phase 2. Because no detox is in a vacuum. They all have other services with it. There's detox, residential, there's supportive residential, partial hospitalization. There's a lot of different things that can be done. We have our continuing care is not complete. And so phase 2 was where we were talking about, not the detox, but we were talking about, hey, let's do residential once we start getting the funding. And once this starts moving, let's talk about doing residential. And that's where we also started talking about the reality that whoever goes into the detox or any program here, we're going to be dealing with co-occurring psychiatric and substance use disorders, so we have to always use best practices as in 42. We talked about the continuum of care, how all of the services here that are nonprofits are being flooded by ASAM level 4 participants. That means detox, and we're having to provide them with the lowest level of outpatient because we don't have that much intensive outpatient. We don't have very much intensive residential. It's limited, so we're very limited into what we have. And so the idea was, let's expand and do phase 2 and look at residential, and that wasn't part of the detox, and let's look at co-occurring issues. And so we're looking at the continuum of care from ASAM, the American Society of Addiction Medication. And over the time, as a committee, or just advisory committee, we've made suggestions, like when we looked at the facility, we saw a place because we said, hey man, wouldn't it be cool if we can have some of these opiate addicts so they don't die when they leave, because there's 330% increase. There was a big space out there, I don't know how they designed it now, but there was a big space where you could do crisis stabilization with a lot of people, and they could stay there 14 days and get their Vivitrol shot. We even had Alkermes come in and make a presentation, and we proposed that Vivitrol should be on the formulary, you know. I know from other programs that I refer clients to that Vivitrol is given when people leave a program like that. You know that, right? We provide it, right? So Vivitrol, you know, you go to a detox residential, they will make sure that you don't die when giving Vivitrol. And so we were talking about that. I just wanted to clarify that, you know, my comments last time weren't directed at anybody that works at Roots or anyone, you know, or anybody at all. I just wanted to give you all an idea of how we could work always towards the indigents. Now, I did make a comment, and I will clarify that because that was for myself. Okay, I primarily do mental health. I do a lot of trauma work. I used to do a lot of co-occurring work, but most of the time now I do it through program evaluation or program development. But I made a comment about the maybe 3 clients a year that I see that need, you know, more intense services. And historically, they want to go out of town. Not anything against Root, but they all want to go out of town. And that's where they've gone, because they have this comprehensive services. We have to remember our history here. Charter Hospital failed. You know, we thought, well, I remember when it was being built, Charter Hospital failed. You know, the psychiatric unit at Doctors Hospital failed. Laredo Medical Center partnered with a detox program and it failed. Okay. We have to remember who are the people that are really needing these services. You know, everybody needs these services, but all of us here work with probably the most needy of the clients. You know? And so I just wanted to point out, I made that comment about my clients, not that anyone from the DAC would not refer to Roots. Obviously not. Everybody wants, you know, everybody's going to refer. You know, I'll refer. But I'm saying, when I ask my clients, you know, I've sent clients to Ozar and they say, okay, well, they said, no, I prefer to go to these places. And that's just been my reality. Maybe somebody else has a different reality. But, you know, I'm just giving you my 2 cents. I have certainly didn't want to disparage anyone from Roots. I didn't even mention anyone's name. I was just talking about, hey, our original recommendation was we wanted a program to serve the underprivileged. That was Judge Hale's idea. That was from the beginning. That was the beginning of this thing. This is what we worked for. And that's fine. We always knew there was going to be insurance and other funding sources. The way WestCare planned it out, they were willing to build a detox and take that hit because they wanted to go ahead and build a residential and all that stuff where they could make more money. They wanted a big footprint in Laredo. That's my say. Gerardo, you were in the meeting, Kike, you were in the meeting. Adi, you want to make any comments? I think this is all I just wanted to say. You know, I had no intention to harm anyone. And I just want to clarify, there's no phase 2 of detox. The co-occurring issues, yeah, you might have in a detox, someone's having hallucination. I'm sure Dr. Fick will give them Cyprexa right away. You know, it's not going to be a problem. We're talking about the residential phase 2 part where we deal with co-occurring disorders and how we need to build a whole continuum of care. If you look at the ASAM continuum of care, we're missing so much. We go from outpatient to residential to no detox.
Having a detox here in Laredo is gonna be a huge thing for us. So honestly, coming from an organization, and I work with various organizations, OSOP as a service is gonna be a game changer locally. I mentioned earlier, we have our own residential centers, but they get packed. And so I mentioned Liberty Lodge, that has nothing to do with SCAM, it's a residential facility that we use because the need is there. So, yeah, I just letting you know that,
And,
pros and cons.
yeah, and just to let you know, the two previous detox that we had in the registered center beer unit, detoxification, evaluation, assessment, referral, it had a detox component and a residential component. And they stepped down. AMA, they had a step down. They did social detox, but they had a residential component. And so that's when we talked about our phase 2, it was just wanting to help the detox because we know there's not enough of scam. And that's when we talk about RFQ because, there's other agencies that are out there that know how to run these programs. That's all. No bad intent.
Thank you, Jesse. I do think there's enough for everybody. There's people that want to go to the faith-based, there's people that want medicine, there's people. So I think that we're, as big as we are here in Laredo, we have enough for everybody. And Pastor Diaz, I just want, you can say a little prayer to end our meeting.